May is Healthy Vision Month, and today we get to chat to two local businesses who share that goal with each person they come across. As part of the Revision Gives Back initiative, the ophthalmology practice shining a light on Prevent Blindness Ohio this month. So from Revision, always good to have with me Paige York, joined today by Amy Pullis. So good to see you both.
Thank you.
Thank you.
All right, Paige, Revision certainly advocates, all right, it is what you do. Everyone be mindful of your eye health. Do the things that you need to do to protect your vision. But start us off maybe with what people should do daily, maybe even yearly, right, to make sure they're putting their vision first.
Of course. So, most importantly, take advantage and get yearly eye exams. That's really one of the best ways you can keep yourself protected and making sure that your overall health and well-being is okay. A dilated eye exam is recommended, and that's typically even covered by people's medical insurance. So
sure.
It's a great starting point. It's the gateway. The eyes are the gateway to your health, so it can identify diseases such as macular degeneration, glaucoma. Diagnosing cataracts can be done at that as well during a dilated eye exam. So that's really on a yearly. You want to do yearly eye exams. On the daily, there are things such as wearing sunglasses, protecting our eyes. We wear sunscreen in the summer. We should be putting sunglasses on to protect our eyes from the harmful rays of UV light as well. And doing things such as keeping your lid hygiene, your eyelashes, your things that can potentially create itchy and dry eyes.
I was going to say, yeah, and people, styes and all those things that you think of that people have. It's all about kind of prevention in that regard.
Exactly. So just eye hygiene, eye health, and then even with the use of screens, taking breaks when you're using your cell phone or computer, those are all things that are going to help with the comfort and the overall well-being of your vision.
All right, perfect tips for everybody. And then each month, Revision LASIK obviously choosing an honoree. This month, we have Prevent Blindness Ohio, Amy, and obviously you guys are on a similar mission, but I love kind of hearing about the realities of this, because I feel like sometimes people hear about vision loss and they think it's somebody else's deal, right? Or it'll happen when I'm 85. What is the reality of what we see?
So the reality of what we see is there are children who have trouble seeing, that they don't even realize that they're having trouble seeing, so then their parents don't know. So the importance of regular eye care for children is really important, and really is what we're doing every day, is just trying to educate those parents on why your child does need to have a regular eye exam. And then as you age, 50% of all vision loss is preventable. Most of that vision loss is from some of those aging eye diseases like macular degeneration, diabetic retinopathy, glaucoma, and cataract. But if you can get those diagnosed early and start your treatment early, then you can slow down or even prevent the vision loss that occurs with those eye diseases. And so that's why we're out there just spreading the word every day of the importance of getting those regular eye exams so that you can get those diagnoses early, and then those treatments started before you do lose your vision.
I was going to say, so you're out there trying to educate, bring awareness obviously to that, but is there a group that maybe is at higher risk, and how are you reaching them to say, hey, yeah, you need to get the eye exam, even the children we're talking about? Right.
Well, so that kind of depends on the eye disease. Everybody is at risk of cataracts. They often say if you live long enough, you're going to end up getting them. Macular degeneration is more common in Caucasians. Glaucoma is more common in African Americans, so it just kind of depends on each individual disease. And then everybody, of course, with diabetes is at great risk of diabetic retinopathy. So really, we're kind of honing in our message based on who we're talking to. We do a lot of work with diabetes organizations and people who serve the diabetes population to make sure that they have what they need to be able to educate the patients that they are serving of the importance of those regular eye diseases. And then, of course, in schools, we work really closely with schools all across the state of Ohio. We're the ones that train most of the school nurses in all of the school districts to be conducting those vision screenings that they're required to do. So then just giving those school nurses the equipment that they need, and then also giving them the education that they can then pass on to their parents about why it's so important to take your child to an eye doctor.
And you guys are kind of that connector too, I feel like. If you need a resource, we'll tell you where to go. If you need some help after this, this is what's in our community, which is great, because that's often the issue too. I need glasses, where do I go?
Yeah,
right?
Exactly.
So that's
and
great.
We're also there to be able, anybody who meets our income qualifications and either doesn't have vision insurance or is what we call underinsured, they can come to us and we can actually get them access to free eye exams and glasses, and then even more extensive care as well. So
Perfect.
So yes, we're a great resource to help people get access to care.
Well, easy to see why Revision chose you this month, obviously. The website up there on screen. Obviously, thank you guys for opening our eyes. There's my pun of the day to all of the ways we can protect our vision. So good to have you both on.
Thank you very much.